I met Dr. Emer a little over 3 years ago. He was applying for a fellowship at the previous office I worked at. And when I found out he was coming down here to work in Beverly Hills, I messaged him and told him I have to work with you. He's very passionate about what he does, and he builds really good relationships with his patients.
Candace has lipedema. In those cases, you have to do a specific form of liposuction, which is called tumescent liposuction, or where you fill the area with a fluid while the patient's awake so they get numb, and then you can remove the fat safely and gently.
Well, I've thought about it for years. I've been wanting to have my legs, I wanted to have the procedure done on my legs. After seeing him, being in the room with him and seeing him perform the procedure and seeing the outcome, it's really amazing. So I decided this is the guy to do it.
I'm really excited to be here today with my patient Candace. She's a patient that has lipedema, has struggled with areas of disproportion, specifically very large legs, hips, lower back, and arms for her entire life.
I've always been uncomfortable with my legs. It's been my problem area even when I was very fit. It was just the area that I hated the most about my body. I decided to have a consultation myself, and when during the consultation, he actually told me I had early stages of lipedema. And so after the consultation, I figured, I've seen what lipedema can do in later stages, in stage 2s and 3s, and how it affects people's lives, and I didn't want that in my future. So it's a preventative procedure for me.
Patients that have lipedema, which is a disproportionate amount of fat in certain areas of their body, particularly of the legs and the arms, can get larger as they get older. And Candace is a younger patient who just had a baby. Hormonal changes can sometimes influence lipedema. So we decided that we were going to get rid of this lipedema fat or this lippy fat now. And that's why we attacked it with doing liposuction. And if liposuction is done properly with gentle extraction of the fat, particularly using water-based devices like a water-assisted liposuction or something called BodyJet, or an ultrasound-assisted fat removal for skin tightening called VASER, you can combine those two and get much better contour and much more improvement, and that's what we did in her case.
I'm just excited. I'm actually beyond excited to see the final result. Now I'm getting ready to go in.
This is something that I truly love to do. I feel that it's not just a surgical procedure, it's a technique, it's an art, and you have to use your skill to get the best results. So I'm excited to be here today on the day of surgery to be able to help her. In her case, we were able to go into her disproportionate legs, which have always been extremely large in size, and her hips, which have always put her body out of balance and made her feel self-conscious and have some pain and swelling. We're able to go into those areas with a water-assisted device and extract fat. I also use ultrasound to give her some further skin tightening. With lipedema, you want to treat the medical condition because it can progress, it can worsen, they can get increased size, damage their joints over time. The ultimate goal is that in the cases of lipedema, we're helping the medical side of it. We're getting rid of the lippy fat, we're improving the lymphatic flow, we're getting rid of the swelling and the pain, but cosmetically, especially in these younger patients that want a better contour, want a better size and the shape, I want to be able to give that to them, and this is what we did for her. So we're here at Candace's follow-up appointment, and she did extremely well.
I feel great. We're 4 days post-procedure.
Patients that have lipedema have a lot of swelling, pain, and bruising after their procedures, but she really didn't have any. And luckily, she didn't because she just had a new baby and she needed to carry her and walk around. Even the day after surgery, she was fine walking around normally.
My pants are looser in my hips, which is a good thing. I'm definitely coming back for more procedures. I actually am talking to Melissa right now to book my next one.